Hello and welcome. Today we're diving into a rare and complex disease, urethral rhabdomyosarcoma. This is a cancer that originates in the skeletal muscle cells, and when it occurs in the urethra, the tube that carries urine from the bladder out of the body, it requires specialized understanding and care. We'll explore what it is, how it develops, and what options are available for those affected. While the exact cause of urethral rhabdomyosarcoma remains largely unknown, several factors are suspected to play a role. Genetic mutations, particularly those affecting genes involved in muscle cell development and growth, are thought to be critical. These mutations can arise spontaneously, or in some cases be linked to inherited genetic conditions like neurofibromatosis type 1 or Li-Fraumeni syndrome, which predispose individuals to various cancers. Environmental factors, such as exposure to certain chemicals or radiation during development, have also been investigated, but definitive links remain elusive. Urethral rhabdomyosarcoma begins when normal muscle cells in the urethral wall undergo malignant transformation. This transformation is driven by the aforementioned genetic mutations, causing uncontrolled cell growth and proliferation. These cancerous cells then form a tumor that can invade surrounding tissues and organs, including the bladder, prostate, and pelvic structures. The tumor can also spread to distant sites in the body through the bloodstream or lymphatic system, a process known as metastasis. This metastatic spread often affects the lungs, bones, and bone marrow, making the disease more difficult to treat. Urethral rhabdomyosarcoma is an extremely rare cancer, representing a small fraction of all soft tissue sarcomas. Because of its rarity, precise epidemiological data is limited. However, it's known to occur more frequently in children and adolescents, with a peak incidence between the ages of 2 and 5. In adults, it is less common, but can still occur. There is no known significant difference in incidence between males and females, although location of the tumor often varies. Its rarity makes gathering precise statistics and conducting large-scale research a challenge. The signs and symptoms of urethral rhabdomyosarcoma can vary depending on the size and location of the tumor. In children, common symptoms include difficulty urinating, a palpable mass in the groin or perineum, blood in the urine hematuria, and urinary incontinence. Adults may experience similar symptoms, as well as pain in the pelvic region, changes in urinary flow, and erectile dysfunction in males. These symptoms are not exclusive to urethral rhabdomyosarcoma and can be indicative of other, more common conditions. Therefore, thorough investigation is critical for accurate diagnosis. Diagnosing urethral rhabdomyosarcoma requires a multifaceted approach. It typically begins with a physical examination and review of the patient's medical history. Imaging studies such as ultrasound, MRI, and CT scans are used to visualize the tumor and assess its size and extent. A definitive diagnosis is established through a biopsy, where a small sample of the tumor is removed and examined under a microscope by a pathologist. Immunohistochemical staining, a specialized laboratory technique, is often used to identify specific proteins in the tumor cells, confirming the diagnosis of rhabdomyosarcoma and helping to determine its subtype. Rhabdomyosarcoma is broadly classified into several subtypes, the two most common being embryonal and alveolar. Embryonal rhabdomyosarcoma is the more frequent subtype and is characterized by cells that resemble developing fetal muscle tissue. Alveolar rhabdomyosarcoma, on the other hand, is characterized by cells arranged in an alveolar-like pattern. There is also a less common subtype called pleomorphic rhabdomyosarcoma, which typically occurs in adults. Determining the specific subtype is crucial, as it influences treatment strategies and prognosis. Urethral rhabdomyosarcoma is most commonly the embryonal subtype, especially in children. The treatment of urethral rhabdomyosarcoma typically involves a combination of surgery, chemotherapy, and radiation therapy. The specific approach depends on the patient's age, the size and location of the tumor, the subtype of rhabdomyosarcoma, and whether the cancer has spread to other parts of the body. Surgery aims to remove as much of the tumor as possible while preserving urinary function. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. Radiation therapy uses high-energy rays to target and destroy cancer cells in the tumor area. In some cases, targeted therapies, which specifically target certain molecules involved in cancer cell growth, may also be used. Currently, there are no known proven methods to prevent urethral rhabdomyosarcoma. Given the suspected role of genetic factors, genetic counseling may be recommended for individuals with a family history of certain cancer syndromes. Avoiding exposure to known carcinogens and maintaining a healthy lifestyle may also help reduce the overall risk of cancer, but these measures have not been specifically linked to preventing urethral rhabdomyosarcoma. The prognosis for patients with urethral rhabdomyosarcoma varies depending on several factors, including the patient's age, the subtype of rhabdomyosarcoma, the stage of the cancer at diagnosis, and the response to treatment. With aggressive multimodal therapy, including surgery, chemotherapy, and radiation therapy, the survival rates for children and adolescents with localized disease have improved significantly in recent decades. However, the prognosis for metastatic disease or recurrent cancer remains less favorable. Ongoing research is focused on developing new and more effective therapies, including targeted therapies and immunotherapies, to improve outcomes for patients with this rare and challenging disease. Recent advances include studies on specific genetic mutations driving tumor growth, leading to the development of drugs that target these mutations directly.